So today I'm going to talk about the arthritic processes which go around the knee and the hip and result in a lot of pain and disability to the patient. Hi, I'm Dr. Burke. I'm Senior Consultant Orthopedics and Joint Replacement Surgery at Apollo Hospitals Noida. So the most common joint involved in arthritis is the knee joint. It's a wear and tear disease which happens over time and starts with the patient has difficulty in getting up from the chair, patient has difficulty in walking for long distances, patient has difficulty in ascending or descending the stairwells. So later on when the process increases, the knee joint range of motion also decreases. There's instability and patients have a lot of difficulty in routine activities of daily life. The management of the condition is in initial stage. We can start with some chondroprotective medications, exercise regimens, lifestyle modification like weight reduction is very important. It's said that if somebody decreases 10% of body weight, the stresses across the knee joint are decreased by 40%. So weight loss is very important. Second is that posture correction. You should not sit cross-legged. You should not use stairwells when a lift is available. There are some medications that you have to take. When the process increases further enough, it is not amenable to conservative management, then we go for a total knee replacement, in which it's like a resurfacing of the bones around the joint. So it is a process which takes around 1.5 for bilateral knees, both the knees, and post-operatively patient doesn't have much difficulty. We make the patient walk around the second post-operative day, and usually exercise and physiotherapy regimen is required for 2 to 3 weeks. Patient requires to use a walker for around say 2 to 3 weeks, and after that patient is walking without a walker. Now done in the Western setup. There are even people are doing it in a daycare setup, but usually we do it in our setup. We do it the patient is admitted for 3 to 5 days. Now regarding the hip joint arthritis is little less common than the knee arthritis. It's usually associated with some injuries in the past or some medical conditions where the blood supply of the head of the femur decreases, which is called the avascular necrosis of the hip. Okay, so in those cases we require to do hip replacements. Sometimes there's a trauma, dislocation of the hip that again disrupts the blood circulation around the hip joint. So hip replacement is done for those conditions.